Now we're rolling. Chris Kessler says studies have shown that unprocessed red meat is not associated with increase in cancer risk and is not associated with increase in heart disease risk. So again, you can talk about these proposed mechanisms all day long, but if it's not showing up in actual events that are meaningful to people, then you might be missing something. Maybe red meat acts in certain ways that you might think would increase the risk of death, but maybe it does other things that reduce the risk of death, and that's why we can't just focus on mechanistic studies. We have to look at actual endpoints. What do you think of this statement?
Well, Chris Kresser's a decent guy. I know him on a personal note. Rather interestingly, on a recent episode of Joe Rogan Experience, he was asked the question, "Are you a nutrition expert?" And he answered very quickly, "No, I'm not. I just know how to read the medical literature." So one has to question whether it's worth taking much of his comments more than just on face value. But in reality, both red meat and processed red meats have a wealth of mechanistic data. We can talk about saturated fat, the absence of fiber, the contribution to rises in TMAO, talk about antibiotics, pesticides, hormones that are in the meats. We can talk about the grilling process and the transformation that makes them more carcinogenic. But the reality is there is plenty of clinical human data of nutrition science. Nutrition science isn't always beautiful. And we'll never have a 10,000 patient study where 5,008 hot dogs and 5,008 broccoli. So we have to rely on the epidemiology that exists. It was strong enough that in October 2015, the World Health Organization and its agencies said processed red meat is not only associated with the risk of cancer, it directly causes colorectal cancer, and it was associated with other cancers like prostate and breast cancer. So I don't think there's any dispute. Nobody's overturned that World Health Organization research project. There have been subsequent publications that have confirmed it and added to its strength. The world agrees. Processed red meat is probably the lowest form of human food, an option for either joy or starvation, but never to be promoted as having health benefits in other circumstances. And my platform always is, it should be the first food banned from hospital systems out of their compassion for their employees, their patients, their guests, not to serve them food proven to cause cancer.
You're a cardiologist. Why don't more doctors and cardiologists talk about diet and its impact on our health? Why don't more med schools? Should people go to their doctor to get advice on diet or heart attack and stroke prevention?
The system needs to be changed quickly and dramatically. When you talk about medical students, residents, and what are called fellows or more advanced trainees, much of the preparation is actually to get them ready to take board examinations, because the program grades itself to some degree by the percentage that pass the national board exams. So until you get a significant number of nutrition questions and balanced and fair nutrition questions on board examinations, it's simply not going to make a big splash with the curriculum committee. In my own city of Detroit and the largest medical school in the United States, Wayne State University School of Medicine, where I serve as a clinical professor, it's been a real struggle. We can get access to medical students at lunchtime, sometimes evening programs. Very, very rarely have we been able to get their real face time during the mainstream curriculum, because it's dedicated to the more pharmacologic and other approaches to disease and not really the root cause of nutrition. When you talk about grown-up physicians, not doctors in training, it's really a matter of exposure. They're humans. They might prefer to play tennis, golf, and read a novel. They're probably not picking up Dr. David Katz's, big Bible of nutrition and reading it for fun. And the other exposure are conferences that many doctors go to, whether they're out of town or hospital grand rounds or hospital morbidity, mortality. It is just a rare event to see a nutrition topic at such events. Sometimes they're sponsored by the pharmaceutical industry, so they're going to feature, a new drug that has a new indication. And sometimes there are other topics, but it's going to be pretty rare to review the, experience with reversal of heart disease and nutrition. They're just not seeing it. So they're picking up USA Today, Wall Street Journal, People Magazine, Sports Illustrated, GQ, whatever it is, probably getting more nutrition exposure from that source than anywhere else, which we know is very clickbait. We know it's very industry funded. we know it's very inaccurate. So it just, when we make it a priority, students, residents, fellows, and staff, medical doctors will have much more exposure to credible nutrition information. And we know it's a problem. Just walk in a doctor's dining room, look around at the food, and 9 times out of 10 you'd say there's not an intelligent species on the planet based on what's being served there, like sausage, muffins, and egg, cheese, omelets, and such.